Welcome, everyone. We're here today to continue talking about peripheral arterial disease. I have Dr. Dorzi with me, and I'm going to ask him to introduce himself.
Hi, my name is Omar Dorzi. I'm the medical director of the vascular services here at UW Valley Medical Center. We have a team of 4 providers that we provide all kinds of services concerning vascular disease, and that includes carotid blockages, peripheral vascular disease, aneurysms, as well as venous disease.
So in our first video, we talked about what the symptoms are, where people might have leg cramps or pain, and being able to recognize that that could potentially be a vascular problem. And now let's talk about what to do next. So if somebody does have these symptoms and they're concerned, or maybe somebody's concerned about a friend or family member, what do you recommend that they do first?
Well, first, I think discussing that with the primary care doctor and maybe meeting with the primary care and going through the risk factors that the patient might have and how we can modify it. And of course, we will be glad to see the patient as well and discuss further these risk modifications, what we call them, and that includes controlling the diabetes and stopping smoking and being more active, try to lose weight, control the blood pressure, and make sure that he takes the right medication to prevent this from getting worse.
And then if it seems like there might be further analysis that the doctor would like to do, what are some of the exams or diagnostic tests that they might order?
Now, we or the primary care doctor can order the vascular ultrasound, and that's the most common non-invasive study that we like to start with. And we have a very excellent vascular lab here at Valley, and we are very meticulous about getting that information, what is needed about the peripheral vascular disease and the extent of it. And if that does not give us a good information, we may need to go to more invasive testing like a CAT scan or even an angiogram.
So if the screening tests have shown that you do have peripheral arterial disease, what would be the first line of treatment that the primary care provider or you would do for that patient?
Now, again, as Dr. Harris mentioned about the levels of peripheral vascular disease, if we're talking about a mild disease where the patient has cramps in the leg or in the calf or in the thigh, and after walking a mile or half a mile or so, we recommend to modify the risks and to put him on a walking exercise. And we may need to add some medication that can help him walk a longer distance. And that also can kind of control the progression of the disease. Now, if the patient presented with a worsening symptoms like pain all the time in the foot or a wound that is not healing, then we're talking about a different classification or a different severity of the disease, and we need to talk about doing procedures to improve the blood flow to that leg.
So what are those procedures? What are the treatments where you would do for those types of patients?
So we typically start with what we call it an angiogram, which is an outpatient procedure. The patient comes in a couple of hours before, and we go in either through the groin or through the wrist, and we go into the artery and we take pictures through the contrast and the imaging that we have, and we evaluate the extent of the blockage. And we will try to open the blockage. And we have different tools. We have all the technologies that we have in the market here at Valley that we can use to try to open the blockage and try to fix it with either balloon, stent, or drug-coated balloon, where this is the newest technology where we deploy the medication into the vessel wall and prevent the blockage from getting worse. Or we may need to put a stent, we may need to shave off some blockage through different catheters and different techniques that we have.
Okay, so now that we've learned about the different vascular surgery treatments, what can you tell us about Valley's program and what makes it unique?
I think we have a comprehensive program. I think we have an excellent 4 providers in our team. We have excellent vascular lab. We have top-of-the-line imaging in our cath lab. We do all kinds of procedures including endovascular techniques as well as open bypass to provide the best care for our patient.
Great. Thank you so much for answering our questions. And for those of you who want to learn more, please go to the links for our website and the details for this video. Thanks for being here.